my name is Shanice. I'm going to have my patient introduce himself to you. Sir, what's your name?
Michael.
Michael, today I'm going to be conducting the eyes, the oral, and the cardiovascular assessment. First, I'm going to do so by asking you to follow my instructions. Can you raise your eyebrows for me, please? Lower and frown for me. Symmetrical movements noted bilaterally. That is checking for cranial nerves 5 and 7. At this point, I'm also inspecting the eyes to make sure that there is no swelling, no lesions present. I'm also going to check by lifting the eyes. The sclera is nice and white. Conjunctiva is pink, and the lacrimal ducts are all intact. No lesions noted, and they are moist and pink. Next, I'm going to check for cranial nerves 3, 4, and 6. I'm checking the extraocular eye movements. Looking forward without moving your head, I'm going to ask you to follow my pen light with just your eyes. And moving in an H formation, the eyes move symmetrically and converge upon themselves. I noted no nystagmus as well, noting that those cranial nerves are intact. I'm also going to check for cranial nerve 3, making sure that the pupils are reactive. I'm going to have you focus at a point over my shoulder, and I'm going to just shine a light. Now I'm checking the left pupil to make sure that it constricts, and then I do so again, making sure that the right pupil constricts as well. And repeating the test on the opposite side, noting the constriction of the pupils on both sides. Cranial nerve 3, the pupils are equal, round, and reactive symmetrically. I'm going to take my endoscope, and I am going to check for the retina as well as the optic nerve, and direct the patient to just continue looking over my shoulder. I'm checking bilaterally. Sorry. Open up for me just a little bit. I'm checking that optic disc for any abnormal findings. Make sure that there's no sign of hemorrhaging, white cottontails, and that the retina is intact with no lesions noted. Now I'm going to check for corneal reflex, the Hirschberg's test. I'm going to shine the light, and I am looking to make sure corneal reflex is intact. And I'm checking to make sure that there is no making sure that there is no shadow noted when shining the light across the patient's cornea. Now moving down to the oral. I'm going to have you open your mouth for me. I'm going to open the blinds to make sure it's a little lighter. The initial part of the vision test is done in a dim room to make sure that I am able to see the pupils reflecting. Looking orally, I'm just making sure that I'm inspecting the teeth, inspecting the gums, as well as the tongue. Stick your tongue out for me, please. And can you move it? Here, you can sit straight. Move your tongue out and to the side. Perfect. That is cranial nerve 10. Just want to stick your tongue out, please. And I'm looking in the back of the throat. Using a tongue depressor. I'm looking at the tonsils. The buccal mucosa is nice and pink and moist. And I'm going to initiate the gag reflex. Open your mouth, please. Open your mouth, please. And you have to stay still. You're going to have to do it. Come on. And the gag reflex is intact. I'm going to just get rid of this. That is cranial nerve 9 and 10. Thank you. I'm going to now test for cranial nerve 7 and 9, which is taste. Sir, if you can close your eyes for me. Close your eyes, please. Close your eyes. I have to do it. Can you tell me what the taste is? Thank you. Cranial nerves 7 and 9 are intact. Now, on inspection, I noted that the buccal mucosa was nice and pink and moist. The hard palate and soft palate are intact. The tonsils are not inflamed. There is no edema noted. No cobblestone noted as well. So cranial nerve 1 would be the sense of smell. I'm going to have you close your eyes. Close your eyes for me. Take a smell. And can you tell me what that smell is? Thank you. I'm going to be checking visual acuity as well as peripheral vision at this point. With his eye covered, I'm going to have him tell me if he can see the numbers I'm holding up without moving his head.
1, 2, 4, 5.
Perfect. And switch eyes. And doing the same test again.
1, 3, 4, 5.
Peripheral vision is intact. And testing for visual acuity. Cover an eye. And I'm going to have you read the lowest line that you can. Read the lowest line that you can.
OLCX.
That is 2050 in the right eye, a visual acuity of 2050 in the right eye. Trade. And then the lowest line that you can see as well.
Front to back or back to front?
Read the lowest one, any one that you can see.
OLCF.
And that is 2050 visual acuity in both eyes bilaterally. Alright. I'm going to check for his cardiovascular now. I'm going to have you take your shirt off. And first we're going to inspect and then palpate. So in inspecting the chest, I'm checking the arm down. I'm inspecting first. I'm making sure that the chest is bilateral. It's bilaterally equal and symmetrical. No lesions noted. Okay. Here is also symmetrical. And I'm going to auscultate his cardiac sounds. So on the right second intercostal space, I am able to hear the aortic valve. Mid-sternal, left intercostal space. I can hear the pulmonic valve and traveling downward right underneath the breastbone at about the 5th intercostal space. I can hear the tricuspid valve moving out laterally. I am able to hear the mitral valve. I hear no adventitious sounds. No bruit is noted, and I can hear the S1 on auscultation. Asking the patient to lie down in a supine position. This is going to be my cardiovascular assessment. Having the patient lie with the right side facing towards me and a 30 to 45 degree angle. I'm going to check for his aortic, his iliac, his renal, and his femoral arteries, as well as for any jugular vein distension, abnormal JVD extension. So first, with palpation, I want to be able to palpate the aortic. And then individually, palpate the iliac, the renal, and the femoral arteries. Which I am able to do so. In order to auscultate using those same areas, check it for the aortic. The iliac, the renal, and the femoral arteries. All arteries are auscultated with no bruits noted. Alright, now I am going to check for jugular vein distension. Having the patient turn his head up and to the right. I'm looking for that carotid artery. I'm able to visualize it. And auscultated with no adventitious sounds noted. That comes to the conclusion of my cardiovascular assessment. Sir, if you want to sit up, thank you.